Alright, today we have a video all about the lungs and asthma. So, as oxygen enters into the mouth, down the trachea, over here, and into the bronchi, which is represented by these guys on this model, then it goes into the bronchioles, which aren't pictured in this, but over here, which are like these tiny branches, and those are attached to little sacs called alveoli. Then those have tiny capillaries surrounding them where oxygen passes into the bloodstream, and the lungs and rib cage expand, which is thanks to this muscle called the diaphragm down here. And so you can see that here as I pull down, the little balloons inflate. So that's the lungs. That's inhalation. And then for exhaling, the carbon dioxide leaves the capillaries surrounding the alveoli and is exhaled out of the lungs as the diaphragm contracts. So inhale, exhale, and the lungs get smaller, along with the rib cage as well, and that's the process of exhalation. So some people have larger or smaller lung capacity than others, and in this model here, we're going to call these pediatric lungs because those came out a lot smaller than I was anticipating. But lung capacity can be affected by many factors. Medical conditions can affect this, such as COPD, congenital lung defects, lung cancer, and asthma. Smoking tobacco greatly decreases lung capacity due to the damage it causes to the alveoli, making it harder for that person to inhale completely. Exercising and living an active lifestyle are some of the easiest ways to increase lung capacity and maintain it over the years. As individuals age, lung capacity naturally decreases, but avoiding tobacco and living an active lifestyle can really help improve lung capacity and maintain current levels. So, asthma is a condition that causes the bronchioles to be inflamed with mucus production, and when something triggers that person's asthma, the bronchioles over here constrict even more, making it really hard to breathe. So you can see that here, a normal airway is nice and open, but with asthma, there's a lot of inflammation here and then that mucus production. So that's really hard to breathe through compared to that. A friend of mine describes having asthma and having an attack is like trying to breathe through a coffee straw. So that would definitely be a lot more exhausting than just regular breathing. So depending on the individual, asthma can be triggered by a variety of causes, such as genetic factors, environmental factors like pollution, exercise, and respiratory tract problems. So if a patient comes to the hospital experiencing an asthma attack, otherwise known as an asthma exasperation, there's many protocols that are put into place to help treat this person. So an asthma exasperation causes decreased perfusion of the alveoli, which causes a decrease in partial pressure of carbon dioxide in arterial blood and causes increased pH from hyperventilation, aka respiratory alkalosis. And as this goes on, the limited airflow will result in a respiratory acidosis, which is a sign of respiratory failure, and that's very dangerous. So it generally presents with a cough, shortness of breath, wheezing, chest tightness, and airflow obstruction. And depending on the patient and what their cause was, some of these symptoms may be present or all of them. And the priority for treating a patient with an asthma attack is to maintain a patent airway, correct hypoxemia, and improve ventilation. So we just want to get that oxygen flowing again. So patients are generally instructed to use their rescue inhaler first, and if they haven't, or even if they have, then we will administer something like albuterol to them to help control those symptoms immediately. And albuterol is a short-acting beta agonist. IV corticosteroids are used next, such as methylprednisolone, and magnesium sulfate can be used to relax the constricted bronchioles since it relaxes smooth muscle, but it can also cause respiratory depression, so it's used depending on the needs of the patient. And in between any and all of these methods or medications, peak flow is measured to see how effective they're being. And then supplemental oxygen can also be given by nasal cannula or face mask if the patient is not responding to any of these mentioned treatments. Intubation and mechanical ventilation may be required because this is a serious emergency. Nursing goals are to minimize symptoms and prevent exacerbations by monitoring vital signs, calming the patient, implementing the provider's orders, and going over patient education. So some important education to go over with a patient with asthma is to talk about rescue plans and how to implement them. This can include things such as using a rescue inhaler and how to measure their peak flow. Going over what triggers their asthma exacerbation, how to avoid it, and what to do if an attack occurs is also very important. So just really creating that plan with the healthcare provider and helping them understand how to use it. Medication compliance, if they're taking a long-acting beta agonist to prevent future asthma attacks, is really important, along with always carrying their rescue inhaler. And then you can also talk about the community resources available to them. So there's several resources online to provide more information about living with asthma, such as the American Lung Association, Allergy and Asthma Network, Asthma and Allergy Foundation of America, and the the CDC. Local weather websites and apps provide information about air quality, so patients know what days to avoid intense outside activities, and many schools have more information for parents so their child can be safe at school. So that's that, and this video was brought to you today by the American Lung Association, our MedSurg textbook, and Merck manuals.